We have seen record numbers for COVID cases and hospitalizations over the past few weeks. We're starting to see some improvement, but we are far from out of this pandemic. To help make sense of the latest COVID numbers and trends, we have Dr. Carolyn Harraway-Smith, the Chief Medical Officer for Women's Services at Cone Health. She's answering your questions and giving you the information that you need to know. All right, so let's first and foremost just start off with the numbers. How many beds at Cone Health are filled with COVID patients, and what percentage of those patients are unvaccinated?
So as of midnight last night, we had a little over 200 patients that were admitted with COVID. And of that number, about 70% were unvaccinated.
All right, so 200 in hospital beds, about 70% unvaccinated. For those who have breakthrough cases, because there's 30% that are vaccinated, help us understand how that can happen if the vaccines are to prevent serious illness and hospitalization.
That's an interesting question, and it's one that really leaves people stumped. But think of it like an army. When we're about to go to war, if the army isn't already prepared and isn't already well trained, then they're going to lose the war. So the vaccine is the process for helping our bodies fight the war when it happens. So if we're exposed to COVID, our body is already prepared to fight that battle. If we have not had a vaccine, there's no preparation. So it's like an army that comes and invades a territory that is not prepared.
Good visual there. But what about those people who had the vaccine and then are still hospitalized? Are these folks with underlying health issues? What is the kind of the explanation for that? Maybe they didn't receive their booster. What is it?
The majority of those patients have not received a booster, or they have underlying medical problems. But remember this, even for those patients who come into the hospital, who've been vaccinated and boosted and still end up in the hospital, their course is a lot different from somebody who's not vaccinated. They don't get nearly as sick. They have fewer complications. They're not hospitalized as long. So there's still lots of benefits to being vaccinated over being unvaccinated.
All right, so as we look ahead, what do we anticipate? Transmission going down? Have we hit our peak and we're going to go down, or where do you think we are?
We are starting to see a decrease in the number of hospitalizations across the region. We had a little bit of a late spike in Reidsville, our neighbors, but in Guilford County, we're starting to see a decrease down, which is always a reminder to stay vigilant. I think what's happened in the past is as the numbers start to go down, people start to drop their guard too early, and then the numbers go back up. So the numbers going down mean that we're doing the right thing, and so we need to keep up the procedures that we've been doing to keep this virus at bay.
Yeah, that was going to be kind of like my follow-up is, you know, when we start hearing that the numbers go down, does that mean maybe, okay, well, I don't really need to get the booster, or I don't need to wear the mask as often kind of thing?
Not at all. It simply means that we're making headway with the things that we've already initiated. Wearing our mask, keeping our distance, trying not to expose ourselves to people who might be high risk or people outside of our immediate families.
All right, so how likely is it, because I think people are looking ahead for the next thing, right, that we get another COVID variant? And when would that happen?
I wish I had a crystal ball to say the when, but it is likely to happen. The nature of viruses are to do what we call mutating. They change. And if it completely burns out, it's less likely to change. But we have a newer variant of the Omicron that's out now. It's the BA.2. We know that it's highly transmissible like the Omicron. It's not as, we don't think that it's going to get people any more sick than the Omicron. And we just have to stay vigilant with the things that we've been doing so that that new variant doesn't do what others have done when we dropped our guard.
All right, so let's move on to kids, because children under 5 are still not eligible for the vaccine. So any updates when they might become eligible?
They're likely to make a decision around February 15th, so keep your ears open around that time for a decision.
All right, in the meantime, advice for parents, caregivers, how to protect their children that cannot get that vaccine until then?
Repeat your question, I'm sorry.
Any advice to caregivers or parents about how to protect their children who can't get that vaccine?
Yeah, for kids, it's the same thing. Little kids will wear masks. I hear a lot of parents say kids won't wear them, but I've seen even little tiny kids wearing masks and they're so cute. But you can mask your kids up when they go to school. Make sure they're washing their hands frequently. Ask them to keep their distance from other children, and especially when they're in the home, be careful to make sure everybody's washing up carefully there as well.
As a healthcare provider, you've seen and experienced a whole lot with COVID. In the break, even just before that, we were talking about how you were never at home because you were always at work, especially the last 2 years. What kind of final thoughts or messages do you want to talk about before we move forward?
I think some of the information and the confusion about the vaccines and seeing people get ill even if they have the vaccine, just remember that the purpose of the vaccine isn't to totally prevent COVID, it's to prevent the negative outcomes of COVID. And we have definitely seen that. Our death rate related to COVID has been much better, especially in the vaccinated group. The hospitalizations in the vaccinated and boosted group are definitely lower. So if you can get a vaccine and get boosted with that third shot, please do. And don't let your guard down. We're all sick of wearing masks, but put your mask on, especially if you're not outside, but if you're in an indoor place, if you're meeting with other people, put your mask on, not just for you, but also to protect them as well.
Mm-hmm.